Hi everyone, and welcome to the third video in the Health Literacy webinar series. My name is Ange, I'm from the Health Promotion team, and with me is Heather, who's also from the Health Promotion team. We've created a series of short videos highlighting the best bits from our recent Health Literacy webinar training. So in today's session, we will be talking about the health literacy guidelines for written and electronic communication, and also most importantly, where to find them and how we can use them. We're going to show you a communications flowchart where we look at the process for putting together written documentation. And then we'll use a couple of tools where we check your documents for readability. So we'll do a little activity around that as well. So to start us off, in 2016, Access developed the Health Literacy Guidelines for written communication. So we can define written communication as being any documentation which is produced on a small or a large scale for our consumers. It could be something like information sheets for type 2 diabetes, a leaflet promoting activities at the community house, or even appointment or intake letters which go out directly to clients. So it can be something which is intended for a few clients only, or something that will be widely distributed and widely available. The guidelines provide really simple and easy tips to use around readability and plain language to help us make our written communication more health literate. So we can see, this almost acts as a bit of a checklist. So it's good to, once you're putting together your document, checking the font, checking the line spacing, have you got dot points in there to break up the information, things like that. So staff can access the guidelines through the intranet. However, it's not something which is currently widely used, and they're actually not that easy to find on the intranet. So I usually use the search function to find them. And because there hasn't been a formal process to support the use of the guidelines, we're hoping that through this short video, we'll be able to provide you with a little bit more guidance around what the correct procedure is to follow. So there are also some really practical tips here around using plain language. And these are things that might seem obvious, or things that we know, but again, it's good to have a reminder and look at the document as a whole. Are you using short sentences, avoiding jargon? Inclusive language is a really good one as well. So using words like you and we instead of, the client and Access Health and Community. In 2018, the Health Literacy Guidelines for electronic communication were developed, and this document includes a short video that explains 4 easy steps for simple website content writing, and the guidelines outline how you go about writing or updating website content. So we would encourage you to go and have a look at the video. But for the purposes of this video, we'll be looking at written communication. So we've put together this flowchart outlining the process for how we produce our written communication. So basically, the checklist summarises the communication procedure and allows you to tick off each step as you go through it. The first stage, if we look at the top, will be drafting your document. So let's say you're putting together an information sheet on blood sugar regulation. Once you've written that piece, the next step would be to check it for readability. There are a couple of different tools you can use to do this, which we will go through in the next slide. Once it's been checked for readability, then you would follow your usual process for approval. So if you need to send it to a manager or senior manager, and then from there are 3 questions to consider. So does this piece of communication need to go to a graphic designer? Will it be widely distributed so lots of people will be seeing it? Or does the document need further health literacy review? And if the answer is yes to any of these, then we go down the left-hand side and a communications request form will be completed, again, which can be found on the intranet. And then that way it will go through marketing to be finalised, and marketing will liaise with the person who's submitted the communications request form, and then it will be reviewed by a health literacy champion, and finally published, printed, distributed, whatever it might be. So I'll now hand over to Heather, who will show you how to use the Microsoft Word Checker. So we're doing the second stage of the flowchart here. We're checking it for readability. And then I'll come back and show you how to use the Hemingway app, which I think is really fun. I'll hand over to Heather.
Thanks, Ange. So there is a way you can check the reading level of your document in Microsoft Word, and I'm going to show you how to do this. Just going to share my screen now. To set this up, you need to open a Word document like this one. Click on File and go to the bottom tab, which is called Options. Under the Proofing tab, which is third from the top, just click on that. And under the title, When Correcting Spelling and Grammar in Word, you need to make sure that the box for Show Readability Statistics is ticked, and then press OK. Now, when you do a spelling and grammar check in Word, a box should appear at the end called the Readability Statistics. The third section in the box under Readability will show your readability statistics. This document has a flash reading ease of 40. The higher the score, the easier it is to read. So a score between 90 and 100 would be easily understandable. But as we can see, this document has scored quite low. The flash Kincaid grade level of this document is 11.7. The higher the score, the easier, this number can be matched to that grade at school. So in this case, a score of 11.7 means grade 11, almost grade 12 secondary school student could read this document. Our guidelines suggest a document should be at a grade 3 or 4 level, but sometimes this isn't achievable. There are some medical, health or technical terms or names that can't be simply replaced, and that's okay. All we're asking for you to do is check the readability of your information and to try to reduce the reading grade level to as low as possible. Obviously, it is better to write your content in simple English from the start, but sometimes that's not as simple as it sounds. It takes practice, particularly as the majority of healthcare professionals have completed further education and are used to writing higher level documents for assignments and reports. I'm now going to hand back over to Ange, who will take you through the activity of using the Hemingway app, which will give you some tips on how to reduce the reading level of your document.
Thanks, Heather. So we've done the Microsoft Word check. We found that the reading level is higher than we would like it to be. So what do we actually do with that information? We're going to use the Hemingway app, and I'll show you how we can make some changes to the same document that Heather was using to make it easier to read and understand. And these will be guided by the health literacy guidelines that we looked at earlier as well. So I will just go to my browser now and just... So this is the landing page that will appear. So you'll see here that it's got some sample text, and on the right-hand side, these helpful little coloured boxes give you an indication of of why the sentence might not be as readable as it could be. So this phrase has a simpler alternative. Sentences being hard to read or very hard to read, and if you just pop your cursor over a word, often it will give you an example of another word to use as well. So how do we use this? So all we do is just delete that text there, and then we copy and paste the document that we want read into it. So this is the same document that Heather was using, and this is a document that we use in health promotion when we are providing potential sporting clubs with a little bit of information about our Inclusive Clubs program. So we can see there is a lot of red here, which is telling us that a lot of these sentences are quite hard to read. And on the right-hand side, we can see it's grade 14 readability. So we want to just try and knock that down a little bit. So if I start with the first sentence up here, that's 3.5 lines. That's quite a long sentence. So I think I'm going to break that up a little bit. So I'm going to take it just by looking at words that might not be as necessary. So encourages participation and leadership from people. I mean, I think because we're already sort of talking about people, we can take that out. I'm going to make that even shorter. So help your club attract and support a more diverse membership, and we can see that that highlighted bit has been taken away already. So then if I just fix that sentence up so that it makes a bit more sense. So encourage participation and leadership, no matter their age, gender, sexuality, race, faith or ability. Because we're already talking about sport, I'm just going to take that out by actually... Yeah, and see it's given us an alternative there as well. So instead of participate, take part. So we can see that already just by doing that first, breaking that into 2 sentences, we've already reduced the grade down to a 12. So yeah, we've knocked it down a couple of grades there as well. So other things that we can use based on the health literacy guidelines, if we look at this last sentence here, it's kind of a list of things. So the workshop topics include governance, policy, etc., etc. I think even just might use some dot points there just to break it up a little bit, and then we'll have a look at what that does to the readability as well. So I think this tool is really useful because it's really easy to use, and it gives you live updates when you make changes as well. So I think it's certainly really user-friendly. So again, that's just by doing that has reduced the reading level as well and increased the overall readability. So that's just a bit of an overview. We could obviously keep going and keep working through all of these to reduce that a little bit further. But I think that is a really useful activity, and hopefully that's something which is helpful for you in your practice. And that is everything from this video and also from this webinar series. So we hope that you have found these to be useful videos. If you ever have any questions around health literacy or need more information or would like to provide any feedback, you can contact Heather or I at the Health Promotion team at any time. Otherwise, thank you for tuning in.